Thank you very much to all the participants in this session. Thank you, Yannis, for your beautiful moderation. So when we're talking about innovation, about processes, let's talk about innovation in pharma and what it means. So pharmaceutical innovation and value-based healthcare. With us we'll have Mrs. Labrina Barmpetaki. She is the president of AbbVie, or rather she's the managing director of AbbVie, and of course president of the AmCham Pharmaceutical Companies Committee. Mr. Angelos Benos, partner pharma and healthcare industry lead. Mr. Evangelos Kalamakis. He is a member of the AmCham's Medical Devices and Diagnostics Committee and Managing Director of Sofmedica, moderated by Mr. Dimitris Karagiorgos, Editorial Director at iatronet.gr. Is Mr. Karagiorgos in the room? I have already introduced the speakers. Now you may take over the moderation. This is a very critical, timely and opportune subject. On the basis of all technological advances, we're talking about new treatments that are very expensive, and there's a question as to why and to what extent this investment in technology may be amortized by the investment in care. I would like to ask Ms. Labrina Barmpetaki, what is her view on this subject? Naturally, I would first of all like to thank you very much for the question, and you ask in a provocative way, and I like this, but I would like to put a table on the issue. The area of bioscience and biotechnology and research and development is, for me, the area in which we will see the most development, the most growth in the years to come. Developments and new mechanism of action, new technology that we expect to keep on increasing life expectancy. And for me, that is not expensive. Okay, we start from that point. It has given value, and I would like to give you some numbers that we're talking about in the Pharmaceutical Companies Committee and the footprint. Pharmaceutical innovation has increased life expectancy of the average Greek by 15 months in the last 10 years. This is clearly due to the fact that solutions were given and answers were given to chronic diseases that torment humanity. I'm talking about cancer and oncology, talking about neurology, immunology. We gave solutions where no solutions were there. But we are waiting for bigger life expectancies and with better quality of life. If you take a patient out of hospital and they can continue their treatment at home, when they can work for many more years rather than being an invalid, when this has a positive footprint in the lives of their carers and their families, for us, this is a key good, and we need to deal with it. So the developments that you mentioned, to name but a few, we expect to be numerous. Here, AI, yes, has helped us, but I would say that the biggest companies in the world at the moment have pipelines and programs that we're talking about gene therapies, cellular therapies, for custom-made therapies and treatments, and we're going to the heart of problems that used to be unsolvable. When we're talking about innovation, oftentimes people ask me, what is the value-based? I mean, how do you calculate value-based? In the next rounds of discussion, we'll talk about that, but for us, the value it brings, apart from the footprint for the patient, is calculated in the value for the healthcare system, because it saves resources where no resources need to be squandered. Let me give you examples. We used to talk about continuous treatments in many areas like hematology and many forms of cancer. Now the patient may be in remission. So this saves us from hospitalization, visits diagnostic and medical centers. We were able to invest these resources of the healthcare system in other as of yet unmet needs. And to talk about a third cycle, because we talked about the patient and the value in the healthcare system, there's a third circle, which is value that it has for the economy of a country when the patients can be prosperous, when they can be productive, and when this treasure, the wealth of knowledge that we as companies find it seen in the GDP. Let me give you an example. As a sector of innovative businesses, we employ 5,000 people directly in Greece. But for each job, we create another 4 jobs in this ecosystem. For people with whom we work, analysts, centers, medical centers, hospitals, consultancy services, research centers. All these things are a wealth, a treasure. Now, I've been for many months abroad, and we're talking about which sectors Greece can be a leader. This is one of the sectors, but we have a very hard truth, which I would also like to share with you and give the floor to the other speakers. That this is not an environment in which innovation is prosperous in Greece, not because it is not valued, but because we don't know what is the assistance it gives to the services and the support to all of us who are trying to bring the know-how into Greece. We're talking about a system to cover the needs. We will always help Greek patients, but this is why we're being penalized. Now, instead of having a support with incentives, taxation incentives, development, growth and investment, we're talking about a taxation system in which innovative businesses oftentimes are called upon to pay back to the state 83% of what they sell, of the turnover. This is not an environment in which any company, allow me to say, can operate. So I would say, to summarize my answer, is that it brings value. Whatever covers a therapeutic treatment need that brings life should be evaluated, it should be assessed in an environment such that of Greece. And there are a lot of prospects, but we are at a point where we need to see how to move forward in the years to come.
Thank you very much. That's why I talked about investment and not about costs when I posed the question. I would like to ask Mr. Benos, based on what Ms. Barmpetaki said, to what extent can the medicines sector contribute to the economic development of a country like Greece? Thank you very much for the question. I would also like to thank the AmCham for the invitation. I'm always honored to receive such an invitation. Look, I often fall in the trap when I take part in a panel where Ms. Barmpetaki is also participating to talk about pharmaceutical innovation. She is a more competent person to talk about that. I don't have much to add to what she has already said. Now, to your question, what I would like to answer is related to the taxation. Generally, we always make the mistake of having these hard talks about expenditure, and we focus less on the income, on the top line. I remember every time that we are talking about taxation, but we don't talk about profits. And the fact is that unless you have profits, you can't pay taxes. And moreover, every time we talk about innovation, every time we talk about the clawback, all the discussion revolves around the expenditure. Of course, it is useful to talk about expenditure. It should not be enormous, but no one is focusing on the way that we can create this cash pile that will allow us to cover the expenditure. We always talk about budget. We always talk about the overprescription. The innovation right now that has to do with pharmaceutical companies, and I believe that the colleagues will confirm that, is the big budget that the pharmaceutical companies have. This money is used in order to pay the employees, invest in technologies, in devices, in CapEx. They are used in hospitals, in partner companies mentioned by Ms. Barmpetaki previously. It is truly surprising that in such an ecosystem, Greece is holding an umbrella. we have no specific process in order to attract these investments, a process that will be the same, permanent. Of course, we have come up with certain concepts that didn't exist in the past. These concepts have helped a lot, but we still haven't seen the results that we expected, results that would allow these companies to bring here clinical studies. The clinical studies right now is the most evident foreign direct investment that the sector could have, an investment that could be used on salaries, on scientists, on hospitals, and generally to create a way to bring down the clawback. And also to have novel drugs here. Right now, the focus of all the stakeholders should be on creating such an environment and on coming to an understanding with these companies so that these investments can include Greece as well. The clinical trials right now could obviously give a breath to the hospitals. They could obviously constitute a release valve for the clawback, and they could also bring treatments which currently do not exist. So personally, I believe that, of course, they can constitute an income for the Greek state. They could take the form of foreign direct investment. We should not turn our back to direct investments. There are mother companies that are directly investing in clinical trials, but still are not allowed to take part in the investment clawback program. Why? Why not? We have Swiss, American, German money that could be invested in the Greek market directly. So why don't we incentivize that? And of course, I believe that the sound use of these programs and good understanding and stability would allow these companies to include Greece in their investment plan. Thank you very much. We will come back to the issue of clinical trials. Mr. Kalamakis, having heard of the painful experience of your colleagues, I would like you to tell us which are the problems that a company operating in Greece is faced with. I'm talking about a company specializing in innovation. Yes, thank you very much. Thank you for the invitation. If you could please upload my presentation. I would like to use some pictures and some figures. Now, value-based healthcare. Basically, what we want to achieve is to strike the best balance of this ratio. On the nominator, we have the outcomes for the patient, and the denominator, direct costs and indirect ones, because very often, as Ms. Barmpetaki said, there are certain things that we do not see. And if we cannot maximize these immediately, at least we want to improve. What we can't see are the ones that you can see on the slide. Over the surface of the water, we can see the direct costs. And since I'm coming from the sector of medical device, I can tell you that these are the services and the devices, but there are also the indirect costs that relate to the duration of hospitalization of the patient, complications, and many other difficulties that create costs. So the approach of providing health on the basis of value needs to take all these into account. And there are certain basic benefits stemming from the value-based healthcare. I would like to focus on 3 of them in order to then talk about innovation, because innovation involves a certain cost, in the beginning at least. So the basic thing we want to do is to resolve the equation for the patient, for the outcomes. For example, how many good outcomes do we have when we have a cataract operation? Then prevention of infections. Or how can we avoid the continuation of administering treatment, since there may be another one that can be more effective? The important thing is that we buy results and not molecules or equipment. This is the important thing. And if we follow this approach, then we can deal with the issue of cost in the long run, having in our minds the overall journey of the patient and know exactly how much this patient costs. When we do that, and if we do that, we can support investments that are resilient in the long run. And I'm using the term investments. Why? Because when there is an investment, the development of new molecules, when there is an investment for the development of new innovative medical devices, the benefits will emerge in the long run. Now, measuring the benefits for the patient, that may be direct and indirect, and taking these into account, we can actually know whether innovation is beneficial or not. And the fact is that the new technologies allow us to collect data. And this is one of the things that make innovation a little bit difficult. We tend to keep the black box closed. And if we want to measure things and know what's inside, we need to use new technologies which allow the collection of data and the drawing of conclusions that we can use in order to improve ourselves. And I would like to show you an example. In the practice we have in medical robotics, we have a surgeon, Mr. Dimov, in Bulgaria, who used different methods in the operations in order to measure the results, either in terms of the hospitalization duration or blood transfusion needs, or more importantly, infections during the operation. All these improved results, and by the way, the lower the bar, the better, are translated into cost avoidance. This is something like the revenue that you mentioned. And it is also translated into euros for a practice in a year. This measurement of results can benefit innovation and can allow us to do many more things that I could tell you in the second round of questions. Thank you. We would like to thank you. I was just looking at how much money is saved. Yes, we're talking about saving during a year, during the operation of 170 operations, open surgery and laparoscopic. Ms. Barmpetaki, since we're talking about cost assessment, but value measurement, I would like to ask you whether there are any mechanisms that we could use in order to assess the value of innovative treatment. Cost benefit, in other words.
Well, of course. The point is to what extent we follow evidence-based decisions or how these decisions look like. I mean, for us as the innovative pharmaceutical companies, our passion is always to reach decision regarding assessment and evaluation or the placement of therapies to be in the logic of the proper drug, the proper treatment for the appropriate patient at the appropriate time, and with monitoring and follow-up of data that proves this equation. So my answer could be none other than yes. In practice, however, I do not believe that in Greece we have in fact followed this model of making evidence-based and number-based decisions. And this does not appear only in the assessment or comparison between treatment options, but even if before we go there, to the assessment and evaluation of what the budget should be that we should have in Greece for pharmaceutical expense. This is the question I always make. How do you calculate it? I can explain how we budget for our company, and I believe that my interlocutor is the same. In health, unfortunately, we're in the logic of a stagnancy, a stable, steady budget for the past 10 years. Other countries, and we need to see whom we're looking at. I mean, even Southern Europe or Northern Europe, the cluster, and others that start farther away from us, have started investing visibly in health. Whereas in our space, in Greece, there is no revision of pharmaceutical expenditure. There's just injections, as it were, with some knee-jerk responses. So we need to realize what our needs are and what would be an annual projection. So I would also like to respond to what you said. When we decide that we need to find a treatment for 1,000 patients, for instance, we need to see what the alternatives are and to evaluate and assess them. And on the basis of this assessment, on what result each treatment brings, and we can document, we need to place them on the axis of evaluation, on negotiation, deliberation, and placement in a treatment protocol. This doesn't happen this way in Greece either. There is a health economic assessment and HTA mechanism, but this is not combined with the decision of what amount we will cover for which patients and where it will rank in the protocol. And let me speak practically. Whether my treatment brings 100% effectiveness in psoriasis and yours 70%, there is a 95% chance for us to be assessed exactly the same. Does that sound reasonable? Is that logical? It happens nowhere else in the country, in the world. So this is the evidence-based or outcomes-based that does not exist in numbers in Greece yet. Which brings me to the third point. Apart from the consultation, the follow-up of treatment outcomes. I mean, we can't have a system like Ivica to have electronic patient files and data and this wealth of data for us to be unable to evaluate it, to see whether the decisions we made were the correct ones, or whether we need to revisit some of these options. So out of 4 treatments, if yours was the better, from what we saw in the number of patients that we had in the fullness of time, then we should give a priority to that one. Or to make an imprint somewhere, not to have an assessment on the basis of the discount mechanisms and the lowest price in Europe the way we have today, but also to explain exactly what we include in this treatment armamentarium, the quiver, and we need to see it. If we can see that my drug saves us 30 days of hospitalization, then we'll use it. But if I manage to do it and I save for the system and the life of the patient 30 days of hospitalization, then I would like to for this to be assessed as well. Now, from what I understood is we're stuck in an accounting model of assessing the value of treatments. Precisely. We're still to combine what to expect, what needs we have and what outcomes we have in the reason of assessment. Mr. Benos, I'd like to come back to you. You talked about clinical trials and clinical studies that apart from all else, all the other positive things they have for the hospital, the economy in general, they have a benefit for the patients because patients have access to innovative treatments that they would otherwise not have. So why is it, in your opinion, we're lagging that much behind as a country in terms of clinical trials, whereas other countries with comparable population with ours and with GDPs or health system organizations similar to ours excel and are that much superior? Now, I couldn't agree more with this extremely accounting model, and accounting at the level of what I said earlier, expenditure alone. At the moment, I mean, to complement what you said in the paradigm, Greece has approximately 1/4 of spending in clinical trials by big companies as compared to Cyprus. Cyprus brings 4-fold as compared to Greece. And here we don't need to compare against Belgium, that can be 100 times, but with Cyprus. And Cyprus is a very good example. Now, the reason why we're not moving forward, in my opinion, is that we haven't assessed correctly the entire economy cycle that has to do with clinical trials. I don't think we have sufficiently understood the financial part in the entire cycle, not just the cycle that I go through the EOF, the Greek HTA, and see. We haven't seen all the side wins that we have, the collateral wins, and everything that has to do with health is fodder to populism. This is the biggest innovation-related problem. So he who puts value and price in front and does not explain all these values of innovation that comes to Greece, not as the end product, which is very expensive, but as to the level that Greece participates in the process of development of this drug, has not been sufficiently explained. What has also not been explained is the benefits we can have as an economy or as patients when we're parts of such a clinical trial process. At the moment, if one were to go into a hospital and tries to understand whether this is a service that the hospital sells, what are the pros and the cons? How can one make profit through this? How can they do that? And we need to see the patients How can we do that? I mean, if you remember a part of that clinical trial, the benefits you have even after the clinical trial does not stop for those who actually participated in the clinical trial, the drug providers. So they exist for the patients, they exist for the state, they exist for the hospitals, for the scientists, doctors, scientific personnel, advisors. All these things are existing in the ecosystem of the clinical trial. Greece has not received this benefit of clinical trials for a very simple reason, that we're always looking at it from the point of view of expenditure, and always in the medium term at best. A clinical trial will start today. It will be completed in 5, 6, 7, 8 years. And obviously, it's not like every clinical trial will change the world. You need hundreds or thousands of clinical trials. You need steady income. It will improve hospitals. It will improve health provisions. It will improve services and obviously times, because a key problem we have is times that hospitals have in our procedures here. If, God willing, we find a framework that is built to attract clinical trials and steady, I mean, these trials run for years. We can't change every year. There needs to be an incentivization policy and a procedure that will be steady, stable for the next 20 years. And at this point, I believe that foreign companies will come because, yes, they do have clinical trials, and two, because they do need access to our population. And yes, we will have health services that will serve their purpose. Mr. Kalamakis, let's approach quality with a quantitative question. I'm talking about private and public hospitalization units. Do they have sufficient equipment that is innovation-based? Yes, well, the simple answer is private ones, yes, public ones, no. One of the difficulties is that this equipment requires a forward-bearing expenditures. We call it the private units because they have a continuity, can assess the benefit and they can sell it as a service. The difficulty is with the public sector, and here we as the industry do have a very significant role to play. The public sector invites us to support it, and we are offering. So to put our money where our mouth is. Now, if we believe that the businesses bring benefit to the patients and their results, then instead of managing the risk of whether to have uninvoiced products or whether we'll have a rebate and when we'll get paid, what we're trying to see is to manage the risk of the results and the provision of services to the patients on the basis of some KPIs and benchmarks. Now, since this is something that the public sector is willing to do it with us, then we will fork out the investment and we will share the benefit in the fullness of time, which every innovation needs in order to bear fruit. Right, one last cycle of questions, or rather the same question for all three of you. Are you optimistic as to what will come to our country in the years to come, each in your sector?
I can see that the time is running, so I will be very brief. I would like to see a mid-term plan in Greece before I reply. Then I will be optimistic. We have suffered a lot during the last few years. We still maintain the reflexes that we developed in the crisis. We eventually need to leave this behind. Now we are talking about Parkinson's disease. I cannot possibly continue explaining to the central authorities about that and about the proper planning. We need to come up with the right planning that will allow us to be optimistic and to do our job, that is, to be beneficial for the patients. I am optimistic by nature. I believe that things will be better for two reasons. First, because there are people that have not stopped talking about the importance of ways and proposals. And second, because I believe that with this year's clawback, we reached the bottom. We are at the level of 83%. So I believe that then the only way to go is to break even. That is, people will work in order to develop drugs so as not to have any profitability stemming from this process. Whatever you measure, you can manage. We know how to measure. I'm optimistic. Thank you very much. Thank you.